So thank you so much. It's a pleasure, it's an honor to be here with new faces, but also very familiar faces, people that we met in Salzburg 2 years ago, Tina and Jaime, for example, people that we've met through the last 2 years in our work in human rights and health systems in Latin America, colleagues from Peru, Costa Rica, Brazil, Uruguay, of course, and colleagues that we've met elsewhere. So it is a pleasure, it's an honor to be here. And the organizing team asked me to try to frame the content, to try to respond one of the questions that I really find striking is, why are we here? Why are we investing, spending 5 days of our lives, of our jobs, in talking not only about the right to health, but particularly about the intersection between right to health and health systems? And I will try to elaborate why. And I have to confess that it was not an easy task. I have to confess that my coffee break was not 15 minutes, but like 5, because I heard some remarks from others that kind of enlightened me, and I took notes. So this is a completely new approach compared to when I left the room. Right? So anyways, 4 things why we're here. The humankind, societies, are now as rich as they've never been before. We were doing a little bit of research, and the total wealth of humankind is around $70 trillion. $70 trillion, 70 followed by 12 zeros. It is a lot of money. 12 years ago, it was only $41 trillion. So over 12 years, humankind has particularly doubled our wealth. And over the 5 last years, we've increased the total health expenditure in 40%. Now we are spending, as humankind, $6.5 trillion a year. In 2007, we were spending or investing $4.7 trillion a year. And that is a lot of money. Just think of how much money we are putting in health. $6.5 trillion. However, how much are we getting back? How much health outcomes? How much equity? How much financial protection? How much human dignity are we getting from that? Well, we have mixed outcomes. On one hand, speaking on Millennium Development Goals, we're doing progress. The latest UN report actually says that we're moving forward in some of these Millennium Development Goals. We are close to reaching the provision of potable water. We are close to reaching, with the exception of Oceania, the goal of reducing by half the incidence of tuberculosis. And we are doing more or less well in reducing by 2/3 the mortality among children. However, those are only 3 of the MDGs. That report also says that we will, as humanity, as humankind, fail in reaching the MDGs. We will fail in HIV/AIDS. We will not reach maternal health, both access and mortality. We will not reach the goal to reduce poverty as we had ambitioned. We will not reach gender equality goals, and the environmental sustainability goal will not be fulfilled. So from the human rights point of view, talking only about health, we are not fulfilling our promise back of 1966, back of Alma-Ata as well, that we will accomplish the highest level of health given our resources. We are failing as humankind. So what can we do about it? And another figure that is really striking is that nowadays we're around 8 billion people in the world. Nearly 2 billion of our humankind do lack either access to medicines or basic services. 1 out of 4 human beings do not have the opportunity to reach services that allows them either to maintain good health and therefore to thrive in life. 1 out of 4. And that is, again, an impressive figure if you think that we are spending $6.5 trillion a year, basically 10%, 9.2% of our global wealth. But not only that, we have impressive inequalities, And we are facing, not only from the MDG side, but as stated by the Minister of Rwanda, we are facing now the consequences of NCDs coming in. So we are facing big challenges that are not only present at the global level, but are also, and I'm sure, are present at the country level. And I'm sure each and every one of the countries that are here are facing similar challenges. You've probably raised your health expenditure, not only in absolute terms, but perhaps in relative terms, or at least you have maintained it. Tina will share with us a story later. She just shared it with me. But you are also probably facing inequalities, both in allocation, but in utilization. And you will most surely be facing now, or in the near future, the challenge of NCDs, both from the health service delivery point of view, but also from the financial or the health financing point of view. So I guess one of the things that we're here is to rethink collectively. How do we face these global and national challenges? Another thing that I think it is very important to state here, and this is where human rights and health systems come together, is that health is stated as a right, but not only as a right, but it's stated also as a fundamental right. And fundamental right means that every single human being has the right to health because he was born as a human being. As we have understood right to health, developed by not only the international covenants, but by thinkers as Amartya Sen, for example, is that the right to health is constitutive because Leonardo was born as a human being. Therefore, regardless of the consequences of Leonardo's right, he is entitled to the right to health. That's what constitutive is about. It's just because I was born with 46 chromosomes that I'm entitled to that right. But also because by realizing my right to health, I can thrive in life and realize other rights like right to education or right to freedom of speech or some other rights. So it has those two dimensions, but very recently in the literature, it has been appearing reports that by using human rights approach, we can actually strengthen health systems. So it has not only the consequence of allowing you to gain a PhD or to come to Salzburg because you did really thrive in life, but from the systemic point of view, it helps you strengthen your health system. Human rights is slightly different, or right to health is slightly different from health systems in different ways that I will just briefly mention 2 or 3 of the most important of them. Human rights and right to health places value in outcomes, just like we do in health systems, but also places value on the processes. And this will be very important as we create our process. And human rights and right to health expects services to be delivered with 4 characteristics. These are mentioned in the General Comment 14th and explained. I will just outline them. Services should be available, accessible, acceptable, meaning cultural differences, for example, and of quality. And if you're coming from the human rights point of view, you say quality. But if you're coming from the health systems point of view, you also say quality. And you immediately start finding the similarities. All of us are here seeking improved health services of quality, acceptable, available, accessible. So that's from the human rights point of view. That's one side. The other side, health systems, is still very much of a debate what health systems are. But health systems are the strategic combination of resources, financial resources, human resources, management, to deliver services that improve 3 or 4 or 5 different outcomes. Health outcomes, definitely. Equity, depending. Financial protection, patient satisfaction, and responsiveness. It really depends which literature you read. But there is a value placed in outcomes. So I think the other reason why we're here, and I would like to see hands up, who of you come from the human rights arena? I would like to see hands up. And who come from the health systems background and are working health systems? Me. I think by joining forces here, we can not only increase and improve health outcomes and efficiency, but we can definitely increase two important things coming from the human rights point of view, is the fairness of our decisions. From the human rights point of view, a decision that is technically sound, it is not acceptable if the process by which that decision was made wasn't fair. So we not only need to improve the data collection and the cost effectiveness and so on and so forth, but we can also improve here in this room the level of at least collective understanding of fairness and also human dignity. Those of us that have had the privilege of seeing patients, we clearly understand what a difference is to see a patient treating him or her in a respectful manner or not. And that also applies for health policy. So that's another area that we can definitely tap in here. So here we have 70 people, a little bit over 70 people, 22 countries. I think we have more women than men. More women than men. Physicians, journalists, lawyers, judges, anthropologists, political scientists, all of us coming together to ask two questions, and most of you saw the leaflet that was sent to your emails before this seminar. We want to ask two questions, overall arcing questions. How can health systems contribute to the realization of the right to health? So how can health systems improve fairness and dignification and health outcomes? But also, how can the right to health contribute to the strengthening of health systems? So it works both ways, right? And just imagine, for example, coming from the human rights point of view, some of you, in this I actually owe to my colleague, Margot, who first introduced me to the Panther approach. So just imagine, for example, one of our health policies that can really work on transparency. Just for example, imagine how much we can do if we improve the level of transparency of health systems financing. Just imagine, for example, if we empower citizens to, using ICTs or any other medium, to allow us to monitor and allow them also to monitor stockouts, to monitor absenteeism, to monitor even quality of services. Just imagine if we create processes by which citizens and communities participate of health policy decision-making and implementation, and by which patients also participate in decision-making processes. There is, again, upcoming literature that is initially displaying that this approach is worth doing from the consequential point of view, from the consequences. Just imagine yourselves if we, by doing that, can change how we are investing 0.1% of those $6.5 trillion. Let's just think that we can work on $65 billion. How much more we can do with that money? And I think that really applies at the global level, but also at your country level. And that is another reason why we're here. I think we're here to rethink some of the things we're doing, to collaborate with each other, to use our human rights, but also health systems background. And I think that's why we're here. Thank you.